Okay, thank you for that.
Morning, ladies.
Good morning.
There's a rock. You know she's a rock star.
Well, now I know she's a rock star. Okay, looks like everyone is here, so we will go ahead and get started. Today is Tuesday, February 18th, 2025. This is the Senate Standing Committee on Licensing and Occupations. Secretary, please call the roll.
Senator Chambers Armstrong, Senator Berg, Senator Douglas, Senator Higdon, Senator Howell, Senator Mays Bledsoe, Senator McDaniel,
Here.
Senator Meredith,
Present.
Senator Nemus,
Present.
Senator Nunn, Chair Rocky Adams.
Here. All right, we have a quorum and we are duly constituted to do business. Let's go ahead and get started with our first bill, Senate Bill 22, sponsored by Senator Reginald Thomas. If you could take your seats and everyone introduce themselves for the record.
Madam Chair, I'm Eden Davis Stevens, General Counsel for the Board of Cosmetology.
Madam Chair, Reginald Thomas, Senator from District 13.
And please proceed.
Thank you. Madam Chair, as I said, I'm Reginald Thomas today, and I represent Senate District 13 here in the Kentucky State Senate. That's in Fayette County. My guests have already introduced themselves, but again, I'll remind everyone it's Joni Upchurch, who's now the Executive Director of the Board of Cosmetology, and Enid, what's your last name again? Stevens. Enid Stevens, who's the General Counsel.
Senator Thomas, before you all get started with your remarks, may I have a motion to adopt PSS 2?
So moved.
Do I have a second? All right, I have a second. All those in favor signify by saying aye.
Aye.
Any opposed? All right, we now have the substitute before us to Senate Bill 22. Thank you.
Thank you, Madam Chair, for doing that. Madam Chair, as you recall last year, one of the items of legislation that we passed that got a great deal of applause was Senate Bill 14, where we corrected a number of injustices that were taking place in the field of cosmetology. And we made great strides in that area on all fronts. And as you can see, we now have a new executive director, a new general counsel, and a new board. And everything's just going smoothly. For those of you that sit on the Legislative Oversight Investigations Committee, you will recall that just in November, 3 months ago, that committee did an extensive year-long report on the Board of Cosmetology and found some scathing findings that we knew about, that we have addressed, and now we're moving forward with respect to the Board of Cosmetology. However, as we all know, anytime we do a bill that involves major policy changes, there are always 2 or 3 things that we omit or need to be cleaned up. And so that's why I'm filing Senate Bill 22 today, to clean up some of the things that we omitted, minor things, to make this board and this act even stronger going forward, and hopefully eliminate the problems that we found with respect to what was cited in the Legislative Oversight Investigations Committee report in November. This bill does 4 things, okay? First of all, over the past year, in 2024, I got a number of phone calls from cosmetologists all over the state, Eastern Kentucky, Northern Kentucky, Western Kentucky, saying, well, if nail technicians and estheticians can take the exam a number of times, why can't we as cosmetologists do that? And my point was, logically, well, why shouldn't you? So that's the first thing this bill does. If you look on Section 1, subparagraph 5 on page 1, and then again on Section 5, subparagraph 6 on page 6, you see what we've done is extend that right, not just to nail technicians and estheticians, but to all cosmetologists, so that everyone has the ability to retake the exam as many times as they can. There's a 1 month period where they have to wait between exams. But again, we want to allow all people who've worked hard, who've studied 750 hours, to be able to be cosmetologists and estheticians, nail technicians. I mean, we're all concerned about beauty and creating a more vibrant workforce. This bill does that. Secondly, the investigations report did recommend that we look at fairer but certainly clearer ways in which we can close facilities if they knowingly, intentionally, are using unlicensed individuals. And you understand this very clearly, Madam Chair, because with your bill on sexual exploitation, the issue that people are most concerned about is that we want to make sure that things that are being done wrong are intentionally taking place, and that's a criminal law requirement. And so what this bill does says if anyone is intentionally using unlicensed people, that the board can step in, Ms. Upchurch can step in, Ms. Stevens can step in and close that facility. Now, they still have to be given due process rights because that's a property interest involved. But the board can close it immediately, and if a hearing takes place, it can take place subsequently. You will find that change on Section 2, subparagraph AB, and that's on page 3 here in this committee sub. Next, the board wants the flexibility, and let me be clear, we are very pleased with the work of Ms. Upchurch, but the board wants the flexibility to be able to hire anyone who meets the qualifications or the skills to be an executive director. Currently, the law says you must be a cosmetologist, but we all know that if you can manage, you can manage. It doesn't matter, how you came up. If you're a good manager, you can manage Walmart, you can manage Apple, you can manage any industry if you have that skill set to be a good manager. We recognize that. And so, therefore, the board has made a change or wants to make a change to say that you don't have to be a licensed cosmetologist or a licensed nail technician. If you got the skill set to be a good manager, then we're going to allow you to manage. And then fourth and finally, recognizing that the United States is bigger than the 50 states, we have a provision in there that says that if you have a comparable license in Guam, let's say, or American Samoa, or Puerto Rico, you can come here and be licensed as a cosmetologist or nail technician as well. And you'll find that in Section 4, paragraph 1 on page 5. So those are the 4 cleanup measures that we have in place. And I'll ask Ms. Upchurch if she wants to add anything to that, or Ms. Stevens. Joni, I'll let you go first.
Good morning. So basically the intentions of SB 22 are just to ensure more accurate fairness and equality among all of our licensees across the Commonwealth. SB 14, when it was passed last year, limited that to one specialized group. And so our intentions as the board and agency is to ensure that equality is reached out to each individual licensee test taker that we have across the Commonwealth. As he said, I did begin this role in October. We've addressed many issues from the LOIC investigation and the suggestions of this committee. Just know we are working hard as an agency to just ensure that we are running as a public agency that we should be running. Thank you.
Ms. Stevens?
Yes, I am mostly focused on how to implement the due process goals of the committee, making sure that the emergency orders are done effectively and only in those narrow instances that truly require an emergency shutdown. But then we are also actively working on new regulations and internal policies regarding the due process and administrative process in general.
Great. Thank you for your testimony. We do have a couple of questions. Senator Higdon?
Thank you, Madam Chair. I guess my question is on the test. Are they required to make another payment when they retest, or is it one time and all these are
No charge? Sorry, every examination is required a fee. Yes, and that we contract out through a testing company.
Okay.
Yes.
And Senator, that's pretty standard. I know with with what I'm more familiar with being a lawyer. If you want to retake the bar, you still got to pay a fee and pay costs to do that. That's only fair because there's labor and work involved with the administration of any test.
But, thank you, and I just ask, this is the Kentucky General Assembly, and sometimes things aren't always what they seem, so, thank you.
Well, you're right about that.
Senator McDaniel?
Thank you, Madam Chair. Senator Thomas, first, thanks for your work on the issue. It started probably, 2 years ago or so that you started down this path, and there were some real unfairnesses that you've worked hard to correct. And
Well, thank
we
you for saying that,
appreciate
Senator
that.
Daniel. Thank you for saying that.
I do have a question, though. One thing that was not addressed on page 6 of the sub, we allow unlimited retests in this, but that coupled with the idea that folks can retest section by section, could you conceivably end up with someone who comes in, and I don't know how many sections there are or what they are, but they take a test basically trying to pass a section. So the next time they show up, say there's 7 total. The next time there's only 6. The next time there's 5. Do you see what I'm saying? Or do they have to retake the entire exam
The
each
entire
time?
exam.
Okay.
Yeah.
I was worried about
Yeah.
a dilution of quality if people were focusing just to pass a particular
It's a
section.
cumulative exam.
So
yeah.
each time they have to take the whole
Yes.
exam, okay, got it.
Yes.
Thank you. Thank you, Madam Chair.
Okay, seeing no further questions, I'll entertain a motion on Senate Bill 22 by PSS2. All right, I have a motion and a second. Secretary, please call the roll.
Senator Chambers Armstrong, Senator Berg, Senator Douglas,
Aye.
Senator Higdon, Senator Howe, Senator Mays Bledsoe, Senator McDaniel,
Aye.
Senator Meredith,
I'd like to explain my vote, please.
Please proceed.
I'm a yes vote. I like this particular provision. You can take the test as many times as you want. I don't know how many licensed professionals we have in our Commonwealth that limit the number of times you can take a test, but I wish we could eliminate those totally, because I think it speaks to a character of a person that if they're persistent and they want to continue to pursue their dreams, we shouldn't be an impediment to that. So it's a good provision. I appreciate that, Senator.
Again, Senator Meredith, I had, during the months of June, July, and August, about 5 families come see me, and they weren't from Fayette County. They were from Eastern Kentucky, as I said, Northern Kentucky, Western Kentucky, and they saw this bill and they said, "Well, I've got a child, I've got a daughter, who's taken this test number, 3 or 4 times, and now they're not allowed to take it, and we want to have the same opportunities as nail technicians." And I agree with you. I mean, if this is the work they're committed to, why are we putting these artificial barriers in place to prevent them from working? We all know, and you've articulated this as well, Senator Meredith, that we have a workforce problem. If people want to work, let's find ways to make them work. So if they pass the test at some point, then they've shown they have the skill set to do the work.
Well, we probably don't recognize that some people just
We're
aren't
in the
good
middle of
test
a
takers.
roll call.
Senator Demus,
Yes, and there is a question I would have asked, but so I'm going to make a comment on it, not ask for a response.
Yes,
back
please
for it.
proceed.
It's an I vote, but you said they would take the whole test back, but on page 1, it says an applicant who fails all or part of the examination shall be eligible to retake the failed portion after 1 month. So we'll discuss that after this, but I have an aye.
Senator Nunn, Chair Rocky Adams.
Aye. All right, this bill passes with all favorable votes. Thank you, Senator Thomas, for your work, and thank you all for being here today. It's a great bill.
Thank you, Madam Chair, and thank you, members of the committee.
Thank you.
All right, next up on our agenda is Senate Bill 100, and it is sponsored by Senator Jimmy Higdon. And as he's making his way to the table, I want the committee to know that there is a sub on Senate Bill 100. It looks like it is PSS1, if that's correct. Okay, members of the committee, can we, please introduce yourselves for the record. Okay, please introduce yourself for the record.
I'll start out. Senator Jimmy Higdon, 14th Senate District, and I'll allow my guests to, if it's okay, to introduce themselves.
Griffin Nemeth, I'm the Youth Advisory Board Coordinator for hashtag Icon in the Trend at the University of Kentucky.
Delaney Crump, I'm a member of the Youth Advisory Board.
Okay, thank you all for being here today. As I mentioned before, we have a sub to Senate Bill 100. Do I have a motion to adopt PSS 1? All right, I have a motion and a second. All those in favor signify by saying aye. Any opposed? All right, thank you. The sub is before us. Please proceed.
Thank you, Madam Chair. I'm allow my guests to go first, and I think they're going to take about 5 minutes. So,
Thank you, Senator. Thank you, Madam Chair and members of the committee for the opportunity to speak before you today. We represent Icon in the Trend at the University of Kentucky, which is a youth tobacco prevention and education program. And I'd like to introduce Delaney, who is one of my Youth Advisory Board members today. Now, she is also a student at Boyd County High School in Ashland. She's a freshman, actually. And she has seen firsthand the experience that is experienced by these students who are affected by our youth nicotine use crisis. And I'd like to invite her to share her experience and her call to action for the committee today.
Good morning, Madam Chair and members of the committee. My name is Delaney, and I'm here not just as a youth advocate, but as a representative of a generation that's being targeted and exploited by an industry that profits from addiction. Every year, around 480,000 Americans die from tobacco-related illnesses. But today, I want to talk about the lives that tobacco takes before those deaths even begin. Imagine this, a middle schooler just 12 years old trying a vape for the first time because it tastes like candy and their favorite influencer said it was cool. They don't realize that one pod contains as much nicotine as 20 cigarettes, and newer devices often contain even more. They don't see the addiction coming, but it grabs hold of them anyways. By high school, they're hooked. This isn't just a hypothetical. It's happening in every classroom, every neighborhood, and every state in our nation. It's happening because the tobacco industry is spending billions of dollars annually to target kids like me, kids who are still growing, still learning, and still imagining what our futures could be. The facts don't lie. Nearly 1 in 10 middle school students and 1 in 5 high school students use e-cigarettes. Flavored tobacco products, menthols, sweet fruity vapes, are directly designed to appeal to youth, and let's not forget, nicotine can permanently damage developing brains. The consequences of inaction are devastating. This isn't just about lung cancer 30 years down the line, it's about kids dropping out of sports because their lungs can't keep up. It's about the anxiety and depression that nicotine fuels. It's about academic distraction and underperformance. It's about an entire generation being stolen before they've had a chance to live fully. Here's what needs to happen. We need stronger enforcement of the Tobacco 21 law. We need to ensure that all retailers are consistently checking IDs to prevent underage sales by establishing a licensing law and conducting annual compliance checks. And we need to implement harsher penalties for stores that break the law, including the loss of their retail licenses, and ensure adequate funding for compliance checks annually and enforcement programs to hold the industry accountable. These changes aren't radical, they're necessary. Every delay costs more lives. Every loophole in legislation lets addiction thrive. You have the power to make a difference, not tomorrow, not next year, but today. What you do here could mean the difference between a 14-year-old taking their first puff or saying, no, I know I'm better than that, or not facing that decision at all. There's a quote that inspires me every day. The true measure of a society is how it treats its youngest and most vulnerable members. Right now, youth are among the most vulnerable to the predatory tactics of big tobacco, but together we can change that. I'm asking you not to just hear me today, but to act boldly, decisively, and with the courage to put the health and the future of our youth above all else. Let's make this a turning point, not just another day of discussion. Thank you.
Thanks, Delaney. Nicotine dependence and the accessibility of these products pose a real threat to Kentucky kids, not just to their health, not just to their education, but to their futures as a whole. I want to thank Senator Higdon for introducing serious legislation that will act to curb youth use rates. We know that Kentucky is one of only about 10 states that does not require any licensing legislation, no tobacco retail licensure, which is going to allow retailers to be licensed, call for compliance checks, and strong enforceable penalties that we're ensuring that these retailers are not selling to underage kids. All retailers of all nicotine products must be licensed in order for this legislation to work. We know that Kentucky has one of the highest densities of retailers as well. In fact, in Kentucky, for every McDonald's that there are, and I love McDonald's, there are about 20 nicotine retailers, at least. And the fact is that we don't even know the true number because these retailers are not licensed. and we cannot ensure that they're not selling to kids by calling for compliance checks and enforcing penalties. Now, proposed policy in general would, as I said and as Delaney said, call for licensure of all products for all retailers. Ensure that we're at least once annually conducting compliance checks to ensure that they are not violating the law. And if they are violating the law, enforce strong escalating penalties for those violations. Now, tobacco retail licensure is not an anti-business measure at all. I think it's pro-business. We care about Kentucky's economy, and I know you all do as well. We want to preserve its integrity and growth. The only businesses who will be harmed by tobacco retail licensure are those acting criminally, those selling often illegal nicotine products to underage kids. Now, I want you to be aware that you will hear about something called registry bills in the coming days or weeks if you haven't already, and that's an alternative to licensing. But what it is an industry-driven, profit-driven tactic to undermine serious legislation, serious policy that's going to protect Kentucky youth. There is no proof that these registry bills offer any protection to our kids or reduce youth rates across Kentucky or in the nation. These bills, instead, are the industry's opportunity to make sure that their products, those with fun flavors and colors, remain accessible to kids and on the market while their competitors are taken off. I know that you all care about our kids. We do too. This is an opportunity to protect their public health. We're asking you today, and on behalf of all Kentucky kids, to please support and pass legislation that is going to curb youth nicotine use rate. I want to thank again Senator Higdon for his responsibility to this and for putting in the work to ensure that our kids are protected. Thank you, Madam Chair and members of the committee for your time today. And I really am very proud of this committee and hope that you will also support Kentucky kids.
Thank you. Thank you, Griffin and Delana. Appreciate that. Also, at this time, everybody just enjoyed a 3-day weekend, but I want to thank the LRC staff. Many of them worked all weekend to make sure that we have a bill deadline, and I know they did. I want to thank Jasmine Williams and ABC Commissioner Allison Taylor for their tremendous help on this piece of legislation. They're truly dedicated, and I want to commend them. I filed an amendment last year to House Bill 11. It closely aligned with this bill. For my 42 years as a retailer, I firmly believe the only way to control the bad actors in this industry is by licensing all retailers of vape, tobacco, and alternative nicotine products. This bill takes a strong step in that direction. This bill has one purpose: to stop the supply of vapes and cigarettes to underage. The majority of Kentucky retailers are great retailers. They follow the law. This bill is directed at bad actors. This legislation establishes the Division of Tobacco, Nicotine, and Vapor Products Licensing within the Department of Alcohol Beverage Control, ABC. The division will be managed by a director. It will enforce regulations on the sale and distribution of tobacco, nicotine, and vapor products. It will develop administrative regs governing these products. Investigators with ABC or the division will have the authority to inspect any premises where tobacco, nicotine, or vapor products are manufactured, stored, or sold. This is the same authority given ABC and their regulators to regulate malt beverage and spirits. Investigators will also have the power to confiscate contraband, just as ABC does. Under this bill, any person, firm, or corporation must obtain a license before selling tobacco, nicotine, or vapor products in Kentucky. That license fee annually will be $250. That's comparable to what it costs to get a beer license in Kentucky. An application fee of $50, and license revocation if fines and penalties are not paid, the retailer cannot renew their license. Retailers who operate without a license will face serious legal consequences. The first offense is a Class B misdemeanor, slap on the hand. Second offense is a Class A misdemeanor. The third and subsequent offenses are Class D felonies. Yes, you could go to jail if you sell these products without a license, and it could land you in jail. This bill has teeth. If you sell products without a license, you will face criminal penalties. Fines for selling unauthorized vape products. If a wholesaler sells an unauthorized vape product, they will face some pretty serious fines also. These are not new to this bill. They're included in House Bill 11 that was passed last year. If a wholesaler sells to unauthorized products or to a retailer, unlicensed retailer, they could be, the first offense is a citation and a $5,000 fine. Second and subsequent citations, a $15,000 fine. And again, these were in last year's, so there's not new to this bill. Strict penalties for selling to underage individuals. Retailers selling tobacco, vape products to anyone under 21 will face escalating penalties. The first offense is a $100 fine to the sales clerk only and a written warning to the owner. The second violation is a $100 fine to the clerk and a $500 fine to the retailer. Third violation, a $100 fine to the sales clerk, a $1,000 fine to the retailer. Fourth violation, you lose your license. And the retailer's banned from reapplying for a license for 2 years. There is an appeal process. Each citation is specific to one location, not to a whole company. Again, this bill targets bad actors, those who knowingly sell to minors and ignore the law. This bill is not aimed at responsible retailers who follow the rules and operate ethically. And that's the majority of the retailers in Kentucky. Will this completely stop underage vaping? Unfortunately, no. But it's a step in the right direction. ABC will establish a complaint-driven system. Folks can go online and file a complaint. Students can do it. Parents, teachers, law enforcement, or other responsible retailers can report violations and can report bad actors, and ABC will investigate. Any person under 21 found in possession of these products may be requested to participate in a community service program or attend a tobacco cessation program. Maybe before this bill gets all the way through the House and becomes law, we can figure out a way to change that may to a shall, but I haven't figured that out yet. But it's a work in progress. Transparency and public awareness. The department will publish a list of licensed retailers on its website and update it monthly. 50% of the collected fines will go to enforcement. The remaining 50% of fines will go to youth education programs about the dangers of nicotine, vaping, and tobacco. Annual compliance checks. All retailers will be randomly inspected at least once a year to ensure compliance. Final thoughts. This bill is about holding bad actors accountable. If you sell without a license, you could go to jail. If you sell to underage individuals, there will be serious financial and legal consequences. I believe the ABC and Division of Tobacco, Nicotine, and Vapor Products will do a great job in enforcing these regulations, ensuring compliance, and protecting our youth. Madam Chair, that's my bill. Be glad to answer any questions, and you might have one other person that wants to speak. I don't know who signed up, but
Yes, so thank you, Senator Higdon. And before we take any questions, we do have a few. There is a Tony Flores. Thank you. Florence. Yes, you can come up to the table and you'll have 3 minutes. So please be brief. We've got a whole nother bill we need to get to. Yeah, come on up. And introduce yourself for the record.
that one's on.
My name's Tony Florence. I'm a member of the Kentucky Smoke Free Association. I own 5 stores and a distribution center for vapor products. And I really want to say that everything that you've said is licensing. As a store owner, I support it. I feel like it brings accountability to the industry. It's easier to keep track of the bad actors in the industry. And I'd even go so far as to say you should tie yourself in possibly with the FDA. They have a very robust inspection unit that every year issues hundreds of warnings to stores that smoke shops and gas stations and C-stores that sell to minors. Might be a possible angle there. So in general, as a store owner, I support this bill. I do have a couple of issues, and it's the minutia. It's kind of the wording that's been around for a while. The bill still contains some contradictory definitions of what an authorized vapor product is and an unauthorized vapor product. An authorized vapor product contains nicotine. An unauthorized vapor product is just any device that has nicotine or any other substance could be unauthorized. So the issue there is it broadly scoops hemp vapor products, in the future medical marijuana vapor products. And having discussed this with the ABC, the way this HB 11 is written and what this is SB 100 is kind of based on, they will enforce against hemp vapor products and medical marijuana vapor products. So the fix there is just taking out or other substances out of the definition of a vapor product, because technically a room humidifier comes under the purview of the ABC. And this seems small, but we've had issues with the ABC over this issue already. The only other thing that I'd like to address is, some of you know, there's a major case in front of the Supreme Court about the vapor industry, Todd Wages, and the FDA. If the Supreme Court sides with the Circuit Court decision and goes with and backs the vapor industry client, then it's going to kind of change the entire complexity and complexion of the underpinnings of what HB 11 and SB 100 is based on, the PMTA process, for what determines whether a product is legal or not. So my request there is, I know this bill goes into effect January 1st. I would like to see if we can push it back to the end of next session, because what happens is they're going to make a decision on this like in June or earlier, which is conveniently soon, but not conveniently after this session is over with. So my concern is, if they side with the Circuit Court decision, which I hope they will, then we're going to be in this weird time frame from January 1st to the end of the session, where we'll have a very limited time to make the amendments and changes to accommodate for how this FDA PMTA process is going to change. And so what I would like to do is move it to the end of the session so we have time to change things, so we can get rid of anything that's not in compliance with the Supreme Court decision, but also supports licensing, which I think is valuable regardless of the Supreme Court decision. So that's kind of my view on that.
Thank you. I appreciate your testimony. We do have a couple of questions. You might want to go ahead and just stay there in case some of the questions are for you. I'll start out with Senator Mays Bledsoe.
Thank you, Chair, and thank you all for your testimony. As a mom of teenagers, you don't have to talk to me about the issues of vaping with our kids in elementary, middle, or high school. And it is something that this bill in particular that we talked about the last 2 years of being so important and holding people accountable for the bad actors. It's not about the ones who are doing the right thing. Mr. Flores, I know you have testified here several times. I'm here, sorry.
Sorry, I was looking for you.
And done a great job of advocating responsible leadership and responsible selling of products. So I want to commend that.
Thank you.
I also want to mention that Delaney did a great job speaking so eloquently for your peers. And I know the program at UK, Griffin, you all have done a phenomenal job. You've testified at the Tobacco Cessation and Oversight Committee several times. The peer-to-peer, as a mom, I can talk all day about why my kids shouldn't do something, but when a respected peer makes that advocacy, it makes a huge difference. And what you're doing, going school to school and being an advocate for people, is amazing. And I hope you know how proud we are as parents to see you doing that for the future of Kentucky's kids. So that's amazing. And I was going to ask the question about the registry versus the license, but you did a great job advocating why the licensure is so much more important than the other. And then two, I'm glad the alcohol, we're holding it to the same standard. And these are the same kind of things that you begin early. When you start a vape, you're more likely to continue down that path. Just like when you start drinking beer, you're more likely to go down other paths. And so just holding everyone to the same kind of standard, I think, is important with the ABC. And I think you raised some good concerns about maybe the logistics of putting the bill, so I hope we take that into consideration moving forward. And I think you've done a great job, and I just applaud the effort. Thank you.
Thank you, Senator. And I believe in the process. You know, I know this bill's not perfect, and there'll be some others that makes, some significant changes or good changes to it. So I believe in the process, and I think we'll get it right.
Senator Howell,
Thank you, Madam Chair. I've got a couple of quick questions, if I can.
please proceed.
Senator Higdon, thank you. You and I have talked about this a lot. Thank you for bringing this bill, but I've actually got a couple of questions for your guests. So if they could slide back up here. Actually, this Delaney, is that right? I'm going to ask you, so if you want to come up. I'm going to put you on the hot seat here. So I've got I have 3 children. My youngest is a year older than you, and we've talked about this a lot. But I've never thought to ask them a couple of questions. So I'm gonna put you on a hot seat. They're used to it, so you might as well get used to it too. You talked about peers vaping. About if you could estimate a percentage of your peers that regular vape, could you even give a guess as a freshman in high school?
A lot.
It's noticeable, isn't it? You see it.
Yeah.
They have them. Their vapes in school. They have them out in school. You'll never see somebody pull a Truly or a beer out of their purse or their backpack in school. But we see this all the time. There's a level of acceptance, almost that we're used to seeing it, and it makes it so much easier, which makes regulations like this so much more important. But how many of your peers? Where do you think they get these vapes at 13, 14, 15 years old?
So there's a lot of places they could be getting them. I know that there's definitely adults that I've heard of buying people or students stuff like this, and then I'm sure there's some retailers that are not doing what they're supposed to be doing.
You can hear people talk about that in halls and stuff like that. How many of your peers do you know that get help to recover from vaping, to stop vaping? Is that something that you see much?
Not really. You hear a lot of people say that they want to quit, but they don't really have any resources that they know how to.
Following up on something that my friend Senator Bledsoe said, you did a really good job today. Your Senate seat is held by a really strong woman, and in 15 years, you're eligible to run for the Senate, and I would highly encourage you to think about it. Thanks for your time today.
Thank you.
Senator Chambers Armstrong.
Thank you, Madam Chair. I want to echo what has been said. Senator Higdon, thank you for this bill. It is really important. And to our young people, thank you for what you're doing. Your voices are really important, and you are making a difference being here today and working on this. I will say the thing that concerns me is the testimony about these companies that intentionally design these to appeal to our young people, to make the candy flavors and the bright colors and make them. I've seen people have told me about ones that look like flash drives that you can like hide in your backpack. And I don't know what we do about that, but it concerns me that there are folks out there that are making money by intentionally targeting our children and leaving them with lifelong health impacts. That's really concerning to me. But Senator Higdon, I'll be a proud yes on your bill today. And I was just curious, I know Louisville, where I represent, has a similar local law around licensing for folks who sell tobacco products. And this is much more extensive and has a lot more teeth than that, I believe. But just for folks who were perhaps concerned that there might be disruptions or this might cause problems, when working on this bill, did you hear any concerns about the Louisville laws? How did those inform your experience? Because my understanding is those have been implemented very smoothly.
Thank you, and that's a very good question. The bill's been filed for well over a week, and I have not had any feedback from anybody in Jefferson County concerned about their bill, about local licensing, that this would interrupt that.
And just a quick follow-up, if I may, Madam Chair. And I think my question is more, it seems like we can learn from Louisville's experience that when we begin these licensing programs, they go well, the sky does not fall, and hopefully they're making an impact and making a difference and helping to keep our kids safe. So thank you all for your work on this, and I'll look forward to voting yes for it.
Thank you.
All right, seeing no further questions, do I have a motion on Senate Bill 100 as amended by PSS 1? All right, I have a motion and a second. Secretary, please call the roll.
Senator Chambers Armstrong. Senator Berg.
I explain my vote, please.
Please proceed.
I want to just say, really, from the bottom of my heart, guys, thank you, thank you, thank you. I mean, I don't know if people out there understand, nicotine is as addicted as opioids are. It is extremely addicting. And I know growing up in Kentucky that I was able to purchase cigarettes by the time I was 12 years old without any difficulty whatsoever. So this is really, God willing, going to have a significant impact on the health and well-being of the younger generation in this state. So thank you, thank you, thank you.
Senator Douglas.
Aye, but may I also explain my vote, Madam Chair?
Please proceed.
Thank you. I'll try to make this quick. Senator Higdon, I really want to thank you for bringing this bill. Being in the healthcare space, this is extremely important, not only to our youth, but to our entire population. And I also want to thank those of you who brought other testimony in here. You know, we are 3 children, and no matter how we want to take a look at the data regarding this situation, young people are still more influenced by their caregivers and their families than they are their peers. I know the media may tell you something different, but the data out there is totally different. I understand that we're talking about what we as a General Assembly or we as elected officials can do, but I don't want us to forget what happens at home and the parental participation that we need. You know, we in the government want to guard these safety concerns, and I think sometimes it's easier to blame elected officials and safety officials and all those other things and actually forget what happens in our home environments. And so I'm going to continue to toot that horn. If we want to make substantive progress in this particular area, we also have to make sure that we're talking to our parents or our other the other people who take care of the young people in our society. Thank you, Madam Chair.
Thank you.
Senator Higdon.
Aye.
Senator Howe.
You explain my vote.
Please proceed.
I'm a vote aye, and thank you for bringing this. And it's a good first step, especially attacking the supply side of this, but I would encourage all of us to take some good looks at enhancing and building on the programs that allow people to, and especially our kids, to get off of vaping, like the program at UK that has had some success, and I think we need to start focusing on that as well.
Senator Mays Bledsoe. Senator McDaniel.
Aye.
Senator Meredith. Senator Nemus.
Aye.
Senator Nunn. Chair Rocky Adams.
Aye. All right, Senate Bill 100 passes with favorable expression. Thank you very much, and I appreciate your testimony.
Thank you, Madam Chair and members of the committee.
All right, last on our agenda is Senate Bill 88. This is sponsored by Senator Tishner. It's making her way to the table. And this is our last bill, but I have a feeling it's going to be a robust discussion. I have 3 people who have signed up to speak also. So let's try to keep our comments tight, and let's try to get through as much as we can. So, Senator, please introduce yourself for the record and proceed.
Senator Lindsay Titchener, Senate District 6.
Aaron Chalmers, President of the Kentucky Academy of Physician Assistants.
Andrew Rutherford, Chair of the Government Affairs Committee for the Kentucky Academy of Physician Assistants.
And there is a Senate subcommittee on this. If we could have that adopted, please.
Okay, let's go ahead. What's the number on this sub? I don't have it. Okay, we have PSS 1 as the subs to Senate Bill 88. Do I have a motion on the sub? Do I have a second? All right, I have a motion and a second. All those in favor signify by saying aye. Any opposed? All right, the sub is before us.
Thank you. I first heard this this proposed bill in Health Services Committee over the interim, and it was an interesting discussion because this really is just modernizing language from the role of a physician and a physician assistant from supervisory to collaborating. And I feel like that's a pretty simple step in order to open the doors for our healthcare industry, which we're seeing a shortage in several parts of the state in a lot of areas. And I think collaborating with physicians is a great idea, and it's hopefully going to just modernize some of our language. The update to the language in this bill is really about meeting workforce need in order to help fill critical vacancies we're seeing across our state in the healthcare space. Considering that the healthcare deserts exist particularly in our rural areas, there are 16% of our 1,850 physician assistants practice in those rural areas and serve patients collaborating alongside their physicians to assist them with their medical needs. With this measure to modernize PA practice laws, we can allow for greater PA employment opportunities, which can make Kentucky an attractive place for physician assistants. And we have seen over the course of many years, about 50% of our physician assistants leave the state and go practice in areas where the laws have been modernized. So this is an effort to bring us into line with some of the other states in the way that their laws reflect the relationship of collaborating with physicians. And I want to just really briefly read the definition on page 1 of the bill of collaboration. I think it's a valid point to make and what the change is to this bill and the language of the current laws that we have. Collaboration means consultation with or referral to the appropriate physician or other healthcare professional by a physician assistant as indicated by the patient's condition, education, competency, and experience of the physician assistant, and standard of care for the condition. And with that, I will let our other presenters present.
Thank you, Madam Chair and committee members, for allowing me to discuss Senate Bill 88, proposed legislation that promotes healthcare and workforce development. I want to begin by explaining what and who PAs are, physician assistants, as some of you may not be familiar with our profession. PAs are highly trained medical professionals that are licensed to diagnose and treat illnesses, prescribe medications, and provide patient-centered care in nearly every specialty and healthcare setting. The PA profession was, in fact, founded by a physician, Dr. Eugene Stead, and based on team-based collaborative care. We complete a rigorous master's level medical program modeled after medical school curriculum, and we pass a national certification exam. We also work alongside physicians and other healthcare providers as part of the medical team to ensure patients receive high-quality care. Yet, outdated supervision laws limit our ability to fully utilize our training. Senate Bill 88 replaces the outdated supervision model with a collaborative model, aligning practice decisions with team-based care at the practice level. During the COVID-19 pandemic, Kentucky's supervision laws prevented PAs from transitioning into high-need areas, resulting in job losses and reduced care capacity. This legislation is about expanding access, reducing healthcare costs, and keeping Kentucky competitive in attracting and retaining skilled medical providers. We've been working for the last several months with the Little Clinic, a wholly owned subsidiary of the Kroger Company. For many individuals, the Little Clinic inside Kroger provides convenient access to routine care. When these clinics are unavailable, patients are forced to seek care elsewhere, often turning to overcrowded and costly emergency rooms or delaying essential care. In 2024, the Little Clinic experienced a loss of approximately 51,300 patient visits due to ongoing staffing shortages. Across the 43 Little Clinics in Kentucky, there was a combined total of 1,818 fully operating days lost. This bill is not about seeking independent practice. It's about taking a step toward practical, modernized, and team-oriented healthcare. Again, PAs work as part of the healthcare team, and we like being part of that team. In fact, one of the tenets of our oath states, "I will respect my relationship with the physician." I work in PA education. That is a concept that I ensure my students understand. Due to outdated laws and administrative barriers, Kentucky loses about 50% of PA graduates annually to states with more modern practice laws. Senate Bill 88 aligns with Kentucky neighboring states, reduces administrative barriers, and strengthens healthcare teams. Senate Bill 88 is about ensuring that PAs can practice to the full extent of their education and training, not a physician's education and training. Again, this has nothing to do with independent practice. We are not physicians, and none of us claim to be. Put simply, this shift will eliminate administrative barriers that prevent healthcare facilities from hiring PAs, allowing PAs to be more competitive for jobs and supporting healthcare workforce development. Right now, too many PAs are unable to practice where they are needed because of these outdated regulations. Senate Bill 88 modernizes these regulations. I urge you to support Senate Bill 88 to improve access, reduce barriers, and retain skilled providers for Kentucky's patients, whether they live in Louisville, Louisa, Paducah, or as my friend Chalebra would say, Pikeville. or anywhere in between. Thank you for your time, and we're happy to answer any questions.
Okay, well, at this time, any questions on this testimony before I call others up? Or Senator Douglas? Or do you want to wait?
I'll proceed.
Okay.
I'll proceed.
Okay.
Thank you very much, Madam Chair. I do have a few questions, and I think probably some people expect a little bit of this. You've passed previous legislation in the past, and all of that legislation was suggested that it was going to increase access to health care and improve health care outcomes. Can you help me with the data that has showed either of those? I've not been able to find that data.
So with the things that we've passed, we have said that it's part of what needs to happen. We don't have the data. Unfortunately, we're not able to obtain data. That's one of the barriers we have, is we don't have many voices within our state of being able to understand what that data is and to get that data. A lot of the
actually there are a lot of research groups collecting the data, and you're right, that data doesn't exist. The data also doesn't exist in other areas of the healthcare system where allowing an expansion of privileges, which is what we're really talking about here, improves access to healthcare, nor anyone seeking intervention into the healthcare system, nor improving healthcare outcomes. But I have a second question. How does this change make it more make you more competitive with those non-physician groups? Because I know in some of your information it talks about it will make you more competitive with non-physician groups.
Yes, sir. So right now our licensure process is very burdensome. Our licensure has been changed multiple times without PA input or actually any input from many people. We can't find anything on minutes from our Kentucky Board of Medical Licensure and have had no idea that our licensure is being changed when it's been changed. It is much easier when it becomes much more efficient and timely to hire nurse practitioners than it is for PAs. We've had multiple hospital systems reach out to us to say that they are moving towards hiring more nurse practitioners who we believe, we should have equitable footing with because it's easier to hire them. Their licensure process, it's much easier to hire, it's more efficient, and there's less hoops to jump through.
Have you had those conversations with the Kentucky Board? I'm sorry, Madam.
No,
Madam Chair, just one more.
Last question, and then we'll bring
Have you
the
had
other
conversations with the Kentucky Board of Medical Licensure and about those changes and what's been the outcome?
Yes, sir, we have, and nothing's changed. Our licensure's actually been made harder in the last year than it has been made easier.
Okay, that's an interpretive thing. I mean, they may say something different. I'm not defending either group. I'm not defending either group. I'm just not sure if that answers my question. Thank you, Madam Chair.
Okay, and at this time we have 3 people who have signed up to speak. Are you sure? Okay. Yeah, we're just running up on time, so I appreciate that. I do want to get the rest of the testimony in today. We have Corey Meadows from the Kentucky Medical Association, and we have, it looks like Miranda Hayes and a Bob Kuhn. And some of you all are pro, some of you all are con. So if we could, if you all could just all introduce yourselves for the record, and we'll go ahead and start with Corey. And try to, keep your comments concise so that we can try to move through this.
Sure. Thank you, Madam Chair and members of the committee. We appreciate the opportunity to speak to you today about this issue. As indicated for the record, my name is Corey Meadows. I am Deputy Executive Vice President and Director of Advocacy with the Kentucky Medical Association. And on behalf of the KMA, we are here to express strong opposition to SB 88. Physician assistants were established as physician extenders, integral members of the physician-led healthcare team. As their very title implies, they are assistants to physicians, and physicians deeply value the critical role that PAs play in patient care, which is precisely why we have major concerns with the proposals that are being offered in Senate Bill 88. It would significantly alter the legally defined relationship between physicians and PAs by replacing the term supervision with collaboration throughout the entire PA Practice Act. It would also establish a collaborative agreement between physicians and PAs. Let me be very clear about this. This is not just a simple wording change. This represents a fundamental shift in how PAs practice and will practice in Kentucky. Why does supervision matter? The current supervision model provides a clear, structured framework for physician involvement in patient care. It's defined physician oversight and responsibility, ensuring appropriate liability structures. And it's a safeguard to ensure patients receive the highest level of expertise when complex medical decisions are required. By contrast, collaboration, as promoted by the National Physician Assistant Association, introduces significant risks. It's vague. It can be a loosely defined term that could lead to inconsistent oversight, increasing the likelihood of misdiagnoses, unnecessary treatments, overutilization of healthcare resources, and fragmented care. It also creates legal uncertainty regarding medical errors and medical liability, something we don't need more of in the Commonwealth of Kentucky. And potentially it misleads patients who may believe that PAs have the same level of training and expertise as physicians. Furthermore, this bill may inadvertently harm PAs rather than help them. Many physicians highly value their working relationship with the PAs under the current supervision framework. But if this bill is enacted and PAs start to move toward greater autonomy, physicians may be less inclined to enter into collaborative agreements. And this reluctance stems from the loss of direct oversight, which could increase physicians' liability exposure as they would be held responsible for care that they have less oversight over. And it would diminish the ability to ensure and manage the quality of patient care provided by PAs. Perhaps even more concerning is this is not going to be an isolated proposal. This is not going to solve all the world's problems, and we know other legislation is coming. It's a long-term effort by the PA profession to gain independence. This bill may not get us to independence right here and right now, but we know based upon the playbook from the national level that more legislation will be coming your way if this passes. This year they're asking from supervision to collaboration. What comes next? Let me give you a preview. A push to change their title from physician assistant to physician associate, to expand prescriptive authority, including Schedule II controlled substances, the establishment of an independent PA regulatory board, the complete removal of any requirement for physician oversight potentially, and the ability for PAs to directly bill insurance. And if the playbook is any indication, it's on the way. And I want to conclude with this. For more than 20 years, we have repeatedly amended statutes for non-physician practitioners, often under the premise of improving access to care, particularly in rural areas. In just the last 12 years, there have been 10 pieces of legislation passed by the General Assembly pertaining to physician assistants alone. And KMA has worked with CAPA to achieve those things. Yet despite these repeated efforts, Kentucky still faces significant access issues. What we are doing is not working. And instead of addressing the root causes of our healthcare workforce shortages, groups are still asking the legislature, they're asking you, to do through statutory changes what physicians have had to earn through education, training, and experience. And in doing so, we're devaluing physicians and their expertise who are also critical to providing health care in this state. So let's be very clear. It's not going to solve any workforce shortages. It's not going to serve the access. And finally, what I will say is as far as the licensing administrative burdens, let's work on that. We've done that. As I mentioned, 10 pieces of legislation has been filed over the last 12 years. Many of them have included us going and working with CAPA to streamline the process, to reduce burdens, and make not only their life better, but the supervising physician's life better. So with that, thank you again for hearing our comments and happy to answer any questions.
Okay, and we were chuckling up here that it's now 11 o'clock and Senator Schick will probably be rolling over, so angry that, we're going over the time. But if you all could please introduce yourselves for the record and be brief.
Thank you, Madam Chair. I'm Dr. Robert Kuhn, and I am an emergency physician on the south end of Louisville. I want to speak in support of this bill where I work shoulder to shoulder with physician assistants every day. And it is, despite what the bills say or what the wording of the laws, it is a collaborative approach. when you come in the emergency department, the physician assistants are able to see the less serious patients, and they understand their roles and they understand their limits, and where I can focus on the heart attacks and the strokes. I rely on physician assistants, and believe me, we need more physician assistants in the emergency department. I work in a South End working class hospital where we can't hire enough physicians. We can't hire enough PAs either. And to make anything easier to hire PAs and to make their administrative burden less, I am in favor of it because, again, I work shoulder to shoulder with them every day, and it is a collaborative approach. Thank you.
Okay, we have a couple of questions. First of all, Senator Nemes.
Yes, I want to thank Senator Tishner for bringing this forward because her intent is to provide medical care that is lacking. But I know that this appears to be necessary, but I don't think so. You know, we should work harder on putting MDs in rural areas. And I question, will PAs actually practice in rural areas? I question that. And then words matter. Look at the definition. I was told a collaborative and a supervision are the same. They are not. They're totally not. And you say that you have a great collaborative in Louisville. You're right there to supervise them. In a rural area, you're not. This is another encroachment on the medical field, on the doctors. You know, a lot of doctors are for this because it relieves their responsibility. It expands their practice, makes them more money. Does it really help the patients? And it expands their, does away with the responsibility because it says right there in the definition of a collaborative compared to a supervision. You know, I'm thinking we need more doctors. Why go to med school if I'm going to start getting paid the same or do the same as a doctor does? We need more doctors. This is another way for the future kids to say, why be a doctor? I think the future, this will cause in the future less doctors. I don't really have a question. That's just my statement.
Thank you very much. Senator Meredith?
Thank you, Madam Chair. I have to first express my disappointment. We did hear this during the interim and did not hear from you folks at all. Even up to the time that we filed this bill, very little engagement. And I want everybody to understand how important an issue this is. It's not the issue of whether PAs do something, physicians do something. It's trying to address this deep chasm of lack of health care that's most pronounced in rural areas. And the same things I hear to resolve these issues, I've heard for the last 40 years. And we're not making a dent in it. And quite truthfully, I never know what the Kentucky Medical Association is for, only what you're against. I would love to solve this problem. And there's some real solutions that are out there, but you don't communicate with me as to what those are. Now, you say this is potentially showing lack of respect for the medical community. I disagree with you. You know my son's a primary care physician. The lack of respect goes to people in rural communities that cannot access health care, and it's not being addressed. So that end, Madam Chair, this is a serious, serious issue that we can't resolve, I think, in this meeting alone. And I'd like to make a motion to defer this until next week so we can hear more testimony and really give this some due diligence.
Yeah. Okay, great. And I think that, I appreciate that. I do think that is the sentiment of this committee to garner more testimony is what I'm picking up. And so at this time, we will not take any action on Senate Bill 88 as amended by PSS 1, and we will defer with the sponsor and work on some more testimony. Is that appropriate? Okay, I get the thumbs up. So if there are if there's no further business, I would entertain a motion to adjourn. Motion. All right.